Another mother dead because of medical staff and mistakes. Put up the picture full mass. We've reported on this before. Statistical data is available that shows how medical doctors in this country are killing Black women who are pregnant. All right? A newly released information has provided more insight into the death of 30-year-old Black mother Christine Fields. Fields died November 13th, 2023, after undergoing an emergency C-section at Woodhull Medical Center in Brooklyn, New York. The mother of three went into medical crisis, which led staff to perform the procedure. Her fiancé, Jose Perez, claimed she did not want the surgery as it was not part of her original birth plan. She had provided her plan to the attending medical professionals when she was admitted. However, the family alleges staff ignored her birth plan and the family's advocacy on her behalf. Fields also sought the assistance of her delivery specialist, who was unavailable at that time. Her baby's heart rate drops, and there's fetal distress. Ira Newman, the family's attorney, previously explained to local news, quote, "She's rushed in for a C-section, and we are investigating and have learned from the medical examiner's office that there was pooling blood." The New York Times secured a 2-page document of initial findings from New York State Department of Health's investigation. The notes were created on December 18th, just over a month after her passing, and revealed that a mistake by the medical staff played a role in what happened, citing miscommunication. It claims the surgeons failed to notify other members about Fields' complications from the procedure, which notably breaches the safety and health regulations. It mentions a uterine arterial injury, which ultimately resulted in maternal death, according to the report. They admit it. It's in writing. Put it up. Perez called Fields' condition after the surgery. That is the man whose heart was completely shattered. He observed something was visibly wrong with his fiancée in the hours following the son's birth. He brought it to the staff's attention, but alleged the staff did not notice her complications. Before I go further, there's another story that I want you to check out when you get a moment. It's online. I think it's on YouTube as well. There's a judge, former TV judge named Judge Hatchett. Her son went through something very similar. He noticed the signs. He saw it happening. He kept telling medical staff, and they kept telling him he was wrong. She was wrong, his wife, and that they were going to be okay. She died. She's dead now. And he feels like he should have done more, but he trusted experts. The Times noted that the documentation does not include her name or a thorough description of the C-section. However, a doctor who did not want to be identified confirmed with the outlet that it refers to Fields' case. Their probe is still ongoing in the labor and delivery unit. In addition, the Times reported that 2 other anonymous sources who work at the facility claim that some staff members were urged to go to training or review the policies after Fields, as they're calling it, incident. Per the document, the department informed the hospital's leadership that, quote, there is a need for immediate action for patients undergoing procedures to prevent serious adverse outcome. Fields' family announced their plans to sue the hospital for $41 million, alleging careless and negligent treatment, WABC reported. When asked to issue a statement regarding her death, the NYC Health and Hospital System said they've improved their protocols and hired 2 new individuals for anesthesiology departments across our health system. We're using innovative interventions that we believe will address the disparities and race-based health care gaps that historically and disproportionately affect the diverse population of patients we proudly serve. The statement said, they're saying, yep, we kill people based on race. So we have new policies not to kill people based on their race. That's really what the statement says. You read between the lines. Put her up full mask. They took this mother away from those children and that man who loves that woman. Feels death as a grand reminder Black mothers are more likely than any other racial group to die from pregnancy-related factors under the care of a medical doctor. The CDC estimates in 2021 the maternal mortality rate among Black women was nearly 70 deaths for every 100,000 live births. That is damn near 3 times higher than the rate for white women, regardless of income or education. Right? Here we are. Data right in front of us, live examples. But still, there's no racism in America. There's no bias, implicit racism. What is that? So sad for this family to have to experience this. Racism kills, ladies and gentlemen. Racism kills people. That's why it's so important. Thoughts?
Yeah, the maternal mortality rates in this country are absolutely dismal and unacceptable. And it's scary, especially being a woman of color. And I live in Texas, and we have one of the worst maternal mortality rates in the country, even with a world-renowned medical center here in Houston. We portray ourselves as the best country in the world, but we can't even protect our women, our mothers specifically. And yes, accidents can and do happen. Yes, there are a million things that can go wrong during a pregnancy or during a birth, but there is a very troubling trend in this country of stories like this one popping up more and more often. There are also stories that I'm seeing of patients, specifically female patients, who are receiving medical procedures that they did not consent to receiving. And I'm not a doctor, and I would never presume to know the stress or the weight of that job. But I do know that cases like this one, the maternal mortality rate in this country, these are not sustainable. People, perhaps it's a resource issue, perhaps it's a workforce issue, maybe it's bureaucracy, or maybe it is just racism, whether that's overt or covert. Whatever it is, I would love to see more attention and more resources directed towards protecting our mothers, especially our mothers of color. And I realize that that's much easier said than done, but sometimes things are difficult, but it doesn't mean that they're not important.
Very well said.